This video will show how to effectively use the Rhinoplasty Appliance System, RAS. Before you begin, you must wash your hands properly. To perform an initial assessment, it is necessary to examine the baby's face to identify the midline, which is an imaginary vertical line that extends from the top of the forehead, or glabella, to the lowest point of the chin. You must also locate the base of the nose, which forms a horizontal line. The first step is to place the lip tape. If your patient has a unilateral cleft, you should start 1 centimeter laterally before the nasal ala on the unaffected side. Stretch the tissue towards the cleft side, aligning it with the midline and stretching it slightly downwards. And if your patient has a bilateral cleft lip, place the lip tape on the prolabium, centering the tissue towards the midline. Apply gentle pressure downwards and secure it to the sides of the lips on both sides. The next step is to apply the elastic bands and tapes. You must cut 2 long strips of any medical adhesive tape. Then place the rubber elastics between your fingertips so that you can insert the end of one of the strips. Once this is done, bend the end of the strip around the elastic band to secure it. Attach the previously prepared elastic bands and strips to the device's side hooks. The elastic band should be placed at the upper corner of the hooks to avoid appliance rotation. Using a cotton swab, apply a small amount of petroleum jelly around the stents or nasal conformers. To place the device, you must gently insert it into the nostrils. Adjust the device to position the septum in the midline on the vertical axis and elevate the nose on the cleft side to a better position relative to the horizontal axis. When using the Rhinoplasty Appliance System, make sure the elastic bands are angled at 45 degrees and locate the device as much as possible toward the center of the midline and at the level of the nostrils. In unilateral patients, when the septum is straighter, the appliance should create an overcorrection of the septum. Place the tape slightly higher on the side of the affected nostril and move the tape down on the non-cleft side, overcorrecting towards the cleft side. Finally, to remove the RAS, you must remove the elastics from one side of the appliance and then remove it towards the side where the elastics are still in place. Finally, remove the elastics and wash the device with soap and water. Use an interdental brush to wash the inside of the appliance and remove secretions. Never introduce solid objects inside the appliance. This can cause pressure and breakage.